Welcome, everyone. I just wanted to call attention that there is an interpretation feature in the bottom bar of the screen. Please use that if you need translations of this presentation into Spanish, Vietnamese, Hmong, or Mandarin. Thank you.
Good evening, everyone. I'm so happy to be part of this town hall. I want to just acknowledge our board president, Christina Pritchett, who's joined us, as well as two of our board members, both members Garcia and members Morawski, Leticia Garcia and Lisa Morawski. Thank you for joining us as well. To our staff for putting this together. I'm going to be very brief in my introductory remarks. And just express my gratitude to our amazing and talented team that have put a lot of hours, countless hours, in making sure that we continue to prioritize health and safety of all of our students, of our families, and of our staff as well. I can't believe that we're already into November, just about to go on a break for Thanksgiving holidays, of course, and that we started our in-person instruction on September 2nd. And we had a very detailed return to safety plan that included making COVID testing available on each of our 75 campus sites for any student that is interested, as well as staff member. And I just want to acknowledge and recognize the amount of work that went into making sure that that was available to all of our students. I've often said that I get negative test results or antigen rapid test results for my own children who are students here in Sac City Unified, and they're involved in sports. And I just can't imagine how difficult it might be for parents that wouldn't be able or would have to deal with taking their children to a medical facility or a clinic, as opposed to just having our students have access to COVID testing on each of our sites. We've also been doing as much as we could with Sac City Unified sponsored vaccine clinics with a number of partners. We've continued to do that here at CERNA every single Wednesday, and our website, and you'll hear from our staff today about upcoming vaccination clinics as well. I, of course, want to recognize that we are here today because in October, our board took a very bold stance in passing a resolution that makes COVID vaccine mandatory for our students. And I know that there's been a lot of questions about the exemption process and which students would have to undergo routine testing and how do you upload information. And we wanted to make sure that we created this space so that we could provide information about that and answer questions that you might have. And we're very excited to be here to do some of that. There's a lot of interest, of course, in what happens for our younger students, those students who are 5 to 11-year-old. And I want to just recognize that today we have as one of our panelists, Dr. Blumberg, who's nationally recognized and is going to also answer some questions about the COVID vaccine. So just thank you very much for being part of this. Again, we look forward to answering some of the questions that you have that we've received already beforehand, and some other questions that you might have as a result of the town hall. With that, I'm going to turn it over to Board President Christina Pritchett, as well as our board members who also want to provide some introductory comments. Thank you again.
Thank you, and thank you all for joining us this evening. And thank you, Superintendent, for that description of what to expect for this evening. I don't want to take a long time with opening comments because I want to really dig in. I know that many of us board members have received phone calls and emails from concerned parents about how to upload and the worry of and where to put it. So we're hoping that with tonight's presentation, it will set us at ease of where to go, the appropriate places to upload, what the process looks like. If you have any additional questions, please feel free to continue reaching out to board members, to staff at the district office by email or by phone call to us board members. With that, I will hand this over to Member Morawski.
Thank you, President Pritchett. I'll also be very brief. Just wanted to say I thought it was really important to champion this vaccination requirement for our system. The vaccines that we have available are incredibly safe and effective. It's an individual action but it has a collective impact when somebody is vaccinated. And likewise, when somebody is not vaccinated, that's an individual action that also has a collective impact of putting other people at risk. So we have the power to end this kind of reign of COVID in our schools for our kids, to end all these constraints that have been on these on our kids' lives for way too long. We can create these islands of safety in our schools. The vaccines are safe, they're effective. I'm very grateful to Dr. Blumberg for answering questions about that, and just encourage folks to talk to their own pediatricians as well. And just, we can only, put this behind us by working together and making sure everyone who can be vaccinated is. So thank you very much.
Oh, thank you, Vice President Morawski. Member Garcia?
I just wanted to take a moment and welcome everyone for joining us tonight. I think it goes without saying that this is a very important issue and topic, and the importance of keeping our students in the classroom learning. That's just the best way for them to learn. So I just wanted to welcome everyone for taking the time and joining us tonight. And I want to thank Dr. Blumberg for making time to be available and lend his expertise in answering some of the questions from our community. So thank you.
All right, well, thank you so much for that lovely warm welcome. I'm Victoria Flores. I serve as our Director of Student Support and Health Services here at Sac City. I am also a parent of 2 Sac City students and an alum. And so we are here tonight to talk about this vaccine requirement. Next slide, please. So we always ground ourselves in kind of the current reality of COVID in our area. And we've shared this slide at our last board meeting. And I thought it's just a really powerful way to look at how, this pandemic has kind of fallen out. And so this is a screenshot of the Sacramento County Public Health COVID dashboard from last year to current. And so this pink line at the bottom shows us where we were last year, late October, early November with COVID. So we remember we were trying to reach orange, by the fall celebrations, didn't quite make it. And we saw that really big winter wave happen. We came back down again, in the spring. We reopened schools. We were so excited to welcome at least half of our students back. We saw how important it was. And then Delta hit, you can see in the summer. And that's that next peak that we have. But hopefully, a little bit of the difference is we had vaccine in our toolkit, right? So we didn't go quite as high. And now we've come back down, and here we sit in the fall. However, what I want to point out is this red line is above this pink line. So we're already a little higher because of Delta. We've seen a little bit of a wave happen already this fall. The case rates were about 19 new cases per day per 100,000. We've come down to 13.2. However, I do want to say, kind of that past, if we look at what happened last winter, we know that, we're likely to predict going into another wave. We're seeing this internationally happening in Europe. And so what has happened in those other countries has, happened here as well. So this is really what we're getting ready for. And it's why it's so important that we're here tonight talking about vaccination and COVID testing. Next slide, please. So as we look at vaccination, this is a screenshot of Sacramento County, and you'll see there's a little picture here. This is our school district represented on top of this map. And you'll see that the darker areas represent the most vaccinated populations, those zip codes with the highest vaccination rate, 68% or above, and the lighter goes down to the lower. So you'll see we have some of those areas where we know we have really robust vaccination, but we also have, a significant part of our district that still has a lower vaccination rate. 14.7 million children 12 to 17 have been vaccinated nationwide, at least partially. And this is exciting that over 1 million children 5 to to 11, or nearly 1 million children have already been vaccinated from last week. Locally here in our county, 56.6% of our 12 to 17-year-olds are vaccinated. And it's really heartening to see this number continues to tick up. So every time I go to this dashboard to report to you all, we continue to see that grow. And now 5 to 11 is on there. Yes, it's a small number, but Sac City played their part. We vaccinated 269 individuals last week. I think over 160 were in this age range. So we're really excited to bring that to you as well. Next slide, please. And then we look locally. So this is a snapshot of our COVID dashboard that you can find on our district website there at reopeningdashboard.scusd.edu. The purple boxes represent the total number of cases that we've had, 778 cases to date. It was just updated this morning. And that turquoise box is a slice of that 778. So of that 778, 42 people are currently home on isolation because they have COVID. So these are our families, that are impacted right now. Our hearts, go out to them, and we send them our healing thoughts. But this dashboard represents cases that are physically present at school or at work. So when we dive further into our data and really look at all cases, because many cases we see impact whole households. So sometimes people are already home on quarantine when then they later test positive. And we really see that COVID in our district is really kind of starting to impact our TK through 5th graders the most. So that's that 5 to 11 range that just became, eligible for vaccine. So really they're not seeing the impact. This number continues to tick up. It was 43% in October. It's 45% of our total cases right now. Heartening news is our 6th to 12th graders, those that are eligible for vaccine, are starting to come down a little bit, and our staff cases are pretty stable at 17%. So this is, this is data that we really pay, careful attention to, and we continue to post on our website for our communities. Next slide, please. So this was one of our really compelling reasons for why we looked at this path forward, why it's so important for us to be able to keep our schools open and to have safe school. And so we did look at vaccine for all eligible students and staff. That's really what we're encouraging folks to lean into. We do have valid exemptions for medical and personal beliefs that include religious exemptions as well. For those with exemptions or not fully vaccinated, they will participate in regular routine testing. So we have that option there as well, all in service of really increasing our immunity and creating safer schools to allow our schools to remain open. And really, to get back to those things that we so enjoyed and maybe didn't even realize that we would miss, right? Or enjoy, like, watching a play or whatever, other performance maybe our children participate in. Next slide, please. So we just wanted to give you a quick, screenshot. Hopefully you've seen this one-page flyer that we've developed. We have many resources we're developing, and we're asking our school sites to send out, or we are posting on our social media. So if this doesn't look familiar yet, it will. And we did a really simplified version of, if your student's 11 or younger, here's what you need to do. These 2 steps. If your student's 12 or over, here's what you need to do, to really just help break this down for our families. And I'll go into this in more detail. Next slide, please. We've also created this helpful grid that we're going to be posting on our website. And so it really does just call out, for students under 12. So you'll see here in this highlighted yellow, they're not yet required to be vaccinated. We know we've got a lot of questions about that, but we are asking families to submit the form and just select not yet required. There are other data questions we have on there that we to hear back from our families for. They do not need to do an exemption because they're not yet required. However, they do need to register and participate in retesting. That's another way we keep our communities who are fully vaccinated. Yes, we want them to be, yes, we need to have their records, so they need to submit that form and submit their vaccine records. And no, they are not required to test. However, I will say they are welcome to. I too have children in the district who are fully vaccinated, and they participate in the testing every week, probably because they hear their mom talk about it so much. Next slide, please. And then students 12 and over who are not yet fully vaccinated, they actually have a lot of choices here. So, you know, they can get vaccinated, submit their record, either their first or their second dose through that form, or they may file a valid exemption. You know, and this grid includes those that require an additional signature, and then they do need to register and participate in regular routine testing until, until they become fully vaccinated. Next slide, please. So we also have the same for our staff. So very similar to students, right? Yes, we want our staff to be vaccinated. If they are, they're going to submit those records to us if they haven't done so already. Most of our staff have already, complied with that. They do not need to worry about an exemption, and they do not need to participate in regular routine testing, but they may. And the next slide, please. Again, same parity for staff not yet fully vaccinated. They can submit their status to us, or they can submit at a valid exemption, either medical or religious, and they also need to participate in regular routine testing. Next slide, please. And so with that, I am going to turn it over to Dr. Blumberg. We are so lucky to have him here with us tonight. I'm just going to give him a little shout out here. He is a professor and chief of pediatric infectious diseases at UC Davis Children's Hospital and the head of infectious prevention at Shriners Hospital. He's provided expert testimony at numerous California legislative hearings. He works on a federal and an international level on advocacy for children's health. He's worked in clinical trials on an Ebola virus in Liberia, sorry, that's pretty impressive. And he is the co-creator, executive producer, and co-host of the Kids Considered podcast. Thank you so much for being here tonight, Dr. Blumberg.
Great, thank you, Victoria. It's really incredible what we've all been through. And so I'd really like to thank the superintendent and the board members and the administration for all they've done to get school back in session, in-person learning. I mean, we saw, as a pediatrician, I saw how schools are so important, how children being home and distance learning, although Herculean efforts were made to make that useful, and it was useful, students missed being in school, and it affected their mental health, it affected their physical health, and of course it affected their learning. And in the children that I see, when I ask them if they're happy to be back to in-person learning, more than 90% of them say yes. And in the olden days, when I was a student, kids didn't like going to school. And so it's really given, a real appreciation for how important schools are. As Victoria mentioned, we do expect, the modeling does expect another wave of COVID in the winter. COVID is a winter respiratory virus. The environmental conditions will favor transmission in the winter. The models suggest that the surge will be greater than what we saw at the end of August, but not quite as high as we saw last winter. And that's primarily due to increasing levels of immunity, mostly due to vaccine and also due to infection, because the Delta variant is so infectious that at this point in the pandemic, if you haven't been infected and you haven't been vaccinated, you're going to get COVID pretty much. Next slide, please. Yeah, so in terms of the vaccine and how well it works, what we found in terms of children, in terms of comparing vaccination to children to adults, that the antibody responses to vaccination are the same or better than in young adults or in older adults. We don't have an antibody measurement that we can absolutely say correlates with immunity, but clearly higher antibody responses are better. But you really have to do the studies to prove that the vaccines protect. And in both the 5 to 11-year-olds and into the 12 to 17-year-olds, the effectiveness appears to be the same or better compared to adults, compared to younger adults and compared to older adults. We know that as people age, the immune system, the immune responses are weaker. And so this really isn't a surprise that children have a much more robust immune response compared to adults. And so the vaccines do work great. They're very protective. Next slide. In terms of vaccine safety, as a summary, the side effects are very similar in 12 to 15-year-olds compared to young adults. And those side effects, we're all familiar with them. We've all heard about them. They can be fever, headache, fatigue for a day or two, and then local reactions, which primarily consist of redness at the injection site and pain. For some people, this may be quite severe in terms of that they feel like they can't do anything and stay in bed for a day or two. For most people, for most children, they will be able to go about their normal activities. But when you are scheduling vaccination for your children, I would keep that in mind, and I wouldn't schedule a vaccine on a Thursday if Friday they have a big test or a sporting event or they're in a play or something else. I would try to schedule it anticipating that it would be okay to take a day off, a day or two off from school, or do it Friday if there's nothing planned on the weekend, is what a lot of people do also. For the 5 to 11-year-olds, I know vaccines not required in that group at the present time, but just as a FYI, there are less side effects in 5 to 11-year-olds compared to the older age groups, the 12 to 17-year-olds, as well as adults. So they seem to tolerate the vaccine even better. Next slide. The number one concern that I hear from parents is the issue of myocarditis or pericarditis. Myocarditis or pericarditis is inflammation of either the heart or the lining of the heart. This is a very rare side effect that primarily occurs after the second dose of vaccination, 2 to 4 days later, and it's more common in boys than in girls. It seems to be most common in 16 to 25-year-olds, but secondly, the group that's affected is the 12 to 15-year-olds also. It involves the heart, so of course that's really scary. I've seen a lot of children with this after vaccination. I've seen more children with myocarditis after COVID or other infections. It's generally a very mild inflammation. They get better in a day or two, and the therapy is generally really simple. It's aspirin or other anti-inflammatories that bring the inflammation down. But it's important to put this in perspective. This incredibly rare side effect is much more rare than the risk of getting myocarditis if you get COVID. Myocarditis risk with COVID is 100 times higher compared to vaccination. And then the post-inflammatory complication, MIS-C, the multi-system inflammatory syndrome in children, which occurs 2 to 4 weeks after COVID, myocarditis is 1,000 times higher with patients with MIS-C compared to those with vaccination. So the CDC and the FDA did independent, extensive risk-benefit analyses with several different assumptions about the rates of myocarditis, the rate of infection, and their conclusions were clear that the benefits of vaccination clearly outweigh the risks. For people who want to look at this data themselves, I would encourage them to go online, look at the recent CDC and FDA meeting websites. The information is all there, the slides that they looked at, the assumptions that they made, the numbers that they crunched, they're all there. And if people have additional questions or concerns about myocarditis or any other side effect or the effectiveness of vaccine, I would encourage you to talk with your pediatrician or primary care provider and talk with them, because I know that most parents I talk with, the most trusted person related to health for their children is their child's primary care provider. That they have your child's best interest at heart. That's what they care about. And that's the most important thing in terms of vaccination. The number one most important thing is to get your child vaccinated to protect themselves. And as a secondary issue, of course, we want the school to be a safe place for children to be, a safe learning environment. And we want to make sure that we keep the schools open by minimizing transmission at school. And I'll be available later to respond to any questions. Thank you. Oh, sorry. I forgot I had one more slide. Yeah, I just wanted to also mention that one of the things that we talk about with COVID from the beginning was how severe it is in older individuals. And we're really focused in those 65 years of age and older. And they are at highest risk for complications and severe COVID and even death. But that's the highest risk. That doesn't mean that children have no risk of severe COVID. They just have a lower risk. And you can see that in the US, there's been more than 6 million children infected with COVID, more than 60,000 hospitalizations, more than 600 deaths. In the 5 to 11-year-olds, it's the 8th leading cause of death over the past year. And so it can be quite severe. And as a specialist with pediatric infectious disease, I have seen so many children admitted to the intensive care units on ventilators, very sick. And so just because they're at lower risk of severe disease doesn't mean they're at no risk. And that's why it's so important to make sure that children are vaccinated. And that's not even taking into account things like the multi-system inflammatory syndrome in children. And then the children who unfortunately may develop long COVID and have symptoms for several weeks to even months. I think that's my last slide, right? Yeah, thank you.
Yeah. Thank you so much, Dr. Blumberg. And we are going to get to hear from him later in our question and answer session. I'll just say, as someone in our district who's watched every single COVID case come through my email, it's really difficult to see how it really impacts whole entire families, the span of very young children all the way, to maybe older people living in the home. So thank you for that. So I'm going to now pivot and take us through the reporting requirement process. So more of the technical side. So next slide, please. So this is our vaccination status reporting process. So you can go to scusd.edu/report-vaccine. There's also, kind of a big link on the top of our webpage if you need to find that. And this is what the form looks like. So you're going to select either staff or student. There's 2 really large buttons on the page, and you'll see one says staff, one says student. And you're going to click which one applies to you. For myself, it was both, right? I had to do my staff and my students. And you're going to fill out that status regardless of the student's age. Remember, if your child is under 12, you're just going to select not yet required, but we have some other information that we would love to collect from you. You're going to attach your vaccination record or your exemption if your student is over 12. And you do that very similarly to attaching to an email. So you can see our little call out there at the very bottom of this form. It has an add attachment. You choose that file and you'll upload either your record or your vaccination form. The form will be available in multiple languages online, as well as hard copies at each school. We already have those copies translated, and they are available at our schools in a paper form as well. We understand not everyone might be able to access these online forms, and so we do have that as well. We do just really want to encourage people, if they're able to submit these online. It helps our process go a lot faster. Next slide, please. We also have an exemption reporting process. And so again, this can be found on our website as well at scusd.edu/vaccine exemption. When you're in that form though, reporting your status, you can link to this exemption form within. So we've tried to make things really easy. And if you're having, difficulty finding something, let us know. We're very responsive to making real-time edits. So we do have a medical exemption that is available, very similar to the protocol that we have already for school required immunizations. That's a letter that your pediatrician, your medical provider would write and be descriptive. They're pretty familiar with that process. And then we have this form that allows for a student personal belief or religious exemption. And then we have a similar form for staff religious exemptions. You just fill it out, fill out the applicable, areas that you're requesting, and sign at the bottom the affidavit that that's you. review, and then you're going to upload or you can submit it
在这
via
个地方
paper.
在下面只要签名，然后就把这个资料
I
送
think
进
one of
去
our
了。
translators came off line. There we go. We got that. We really do encourage families, though, just like Dr. Blumberg spoke of, consult with your pediatrician, really talk to them, about what's the best option for you and your student. They know your child's health history the best. We also have medical professionals at each one of our vaccine clinics, should you want to come up and talk with them, either one of our doctors or our nurses. And we really just encourage everyone to check whatever data source you're using, really talk to a trusted medical authority. Next slide, please. And then if you're not fully vaccinated yet, you're either in your first dose course or you've chosen exemption at this time, we are going to require that you participate and register for regular routine COVID testing. You can go online. We also have all this information online at COVID-19-testing to find those registration links. You only have to register one time a year, so we've made this really simple and easy. Our testing program is supported by the California Department of Public Health Testing Task Force. We've been working with them since February of 2021, providing COVID testing that Superintendent spoke about at every single school site, as well as here at the Cerna Center. And we offer rapid antigen tests and PCR laboratory process tests. Next slide, please. And so, like I said, so every school site care room has COVID testing throughout the school day readily available. We do host some school site testing events when we've had some of those, fall events happen that required either testing or vaccination. We have our Cerna Center that's open every day, Monday through Friday from 12 to 3:30. Excuse the typo there. And then we are going to be developing regional testing centers. So we've heard from our families, we've heard from our teachers that it's really hard to get to Cerna and we need some after hours options. And so we are going to be rolling out regional testing centers that will be open from 3 to 6:30-ish. We have to get our lab samples back by 7. And we'll be opening those throughout December and January. I know one of our first ones is going to be stood up at Albert Einstein Middle School. If you test at one of our facilities, through our school, then your results will automatically be reported to Sac City Unified, so you don't have to do anything else. Should you choose, though, to test at another facility, we understand parents or staff may want to do that with their health provider or somewhere else where they feel comfortable. They will need to provide their results to Sac City Unified, and we will be developing that process for people to report those results. I also wanted to add, I forgot to say on the other slide, these are self-swabbed tests. So individuals, including children, swab their nose themselves, and they're guided and observed by a trained staff member who makes sure that they're doing it correctly. The kids are the best at this, and they actually really kind of enjoy, I think, that moment of autonomy of being able to do something like this themselves. Next slide, please. As Superintendent had mentioned, we've been doing vaccination clinics also since about February of last year. You can find lots of information on our website, scusd.edu/vaccinations. We have a whole list of all of our upcoming clinics. We have partnered with a host of health organizations, including UC Davis and Dignity and Sac County Public Health. So we really encourage you to check your email. I believe one went out today with a list of clinics and links. myturn.ca.gov is another great resource to find vaccination opportunities. You can actually type in your address and it will show you the clinic closest to where you are. So, the best vaccine you can get is the one you got an appointment for and you showed up for. So next slide, please. And this is just a list of all of our vaccine clinics that we have scheduled already, and many more are coming online. So you can see tomorrow we'll be here at the Cerna Center again from 4 to 7, as well as Elder Creek Elementary down here on Lemon Hill. The next day we've got 2 clinics at Ethel I. Baker and Wilsey Wood, where HealthNet will also be offering the flu vaccine. We've got a wonderful event on Saturday the 20th happening at New Joseph Bonheim with a COVID vaccine vaccine and a food giveaway. We'll also be doing COVID testing there, as well as Success Academy is continuing their weekend neighborhood fairs where they are also vaccinating individuals and providing a host of community resources out here in South Sacramento. And further on, you can see, and more to come. So I will just say we've got a lot more to add. We will be adding COVID vaccine to our school immunization clinic as well here at Sac City. We provide school required immunizations just next door. We are adding COVID on and are looking to go back to Fridays, like Dr. Blumberg spoke of, just so we, you know, if kiddos want to come and get vaccinated, they might have that weekend to recover. I just also want to stress that all of our vaccine clinics moving forward will serve 5 years and older. That was really important to us, as well as the whole entire community. At our last clinic last week, we had a family of 7 walk up. They were our last family, and they all got one of the vaccines. Parents were getting boosters. We had teenagers getting a second dose, and we had 5 to 11-year-olds getting a first dose. And I will hold that moment in my heart, because that's exactly, you know, what we're doing and why. So next slide, please. We also wanted to take you through kind of a new feature on our dashboard. If you've looked at our COVID dashboard, we now have our student vaccination status dashboard. Thank you, Mr. Vincent Flores is going to give us a test drive here live. So what you're seeing at the top is, in this green box, all of the eligible students in our district, right? So this is all of the students. This next purple box is students, fully or partially vaccinated. That means they've had their first or their second dose. The turquoise box are students with an exemption that's already been vetted and validated. And then this orange box are students that have not yet reported yet. So if on the right-hand side, you can see you can sort by school name. So much like our COVID dashboard, trustee area, by grade, and then also by age group. So if you'll select that 12 and up for us, and we can see these are our students who are required right now to take some kind of action, right? You can see right now that 12 and over, 15.59% of our students in that age group have submitted a vaccine record, and 0.22% have submitted an exemption. So this 84%, this large orange area, that's where we really are needing our families to lean in, submit those records through that portal, and let us know what their choices are for their family. So roughly 3,008 students right now have submitted a vaccine record, and we're very grateful, for everyone who's done that. And 42 have submitted a valid exemption. This dashboard, the one thing I want to say is these are the records that have been vetted. So we've gone through them. They are all correct. We had everything we needed, and we've now uploaded them into Infinite Campus. We do have a number of vaccine records, I think nearly 2,000, that our staff are continuing to work through. So we just want to really encourage folks, you can go check out your school site, at this dashboard, and we're hoping to see this, that purple and turquoise box get much larger than the orange one. Superintendent, did you want to add anything here? Good. Okay.
Oh, no,
all right. You're welcome. And then in summary, before we go to our Q&A, just wanted to do a quick summary slide. So if you're fully vaccinated, submit your records, you're done. Check, right? Not yet fully vaccinated or submitting a vaccine, submitting an exemption, you're going to submit your records, register for testing. And if you've already done that, you're good. And then you're done, check. When we return from a winter break, we will be sending out confirmation notices that let individuals know we've received your students' records and you are compliant, with our mandate. We've heard that feedback as well, that folks want to know, did you get it? Is my student cleared? And so we'll be working on that process as well. And that's it for our presentation portion. So I'm going to turn it over to Student Board Member Jacqueline Zhang to start the Q&A. Oh, sorry, and we can go next slide, Vincent.
Mr. Flores, is Student Board Member Zhang online?
I can read the questions on her behalf.
Okay, thank you.
Thank you. So, hello, I'm Nicole Kangas. I am the Community Engagement Manager for Sacramento City Unified School District. And these are some questions that some of our wonderful students sent us that I'm going to be asking of Victoria Flores as well as Dr. Blumberg. What will be the protocol for administering tests at school sites? And how can the school guarantee chain of custody for test samples, as well as will a medical professional oversee the test?
Thank you so much. Yeah, these are great questions. And we've actually been conducting testing since February of 2021. So we've had a lot of practice in this area. And as I shared before, we are working with California Department of Public Health on our testing program. So that's our program. It's run through that program. Our health aides that are out doing the COVID testing have all been trained. So they go through a training with the California Department of Public Health, as well as we've put on our own additional training to help reinforce all of those protocols and measures. So I will say step one is register, register for testing. That's really part of the protocol. If you need to test weekly, we will be providing testing by classroom. And so we have a report that's available or will be available at Infinite Campus that shows us by classroom who needs to be tested. So we will be working with our school sites to do that. As you can imagine, in elementary school, fairly simple. When we start getting into secondary schools, particularly our really large ones, we're going to work with our site leaders on the best way to do that. Our health aides are trained in the rapid antigen tests, which are read and registered right there on site. So that chain of custody happens right there. It's about a 15-minute window that you have to wait for that test to process, and they have a set amount of time to document those results. So with the PCR laboratory tests, those samples are taken, they're put into a tube. You'll see the little baggie that they go into. They all go into a bigger Ziploc baggie, and they actually get dropped off at a secure drop box that's managed by CDPH that goes straight to that Valencia branch library. So that's kind of that chain of custody, and then is processed and resulted, hopefully 24 to 48 hours. We know we've had some times where it's taken a little bit longer. Like I shared before, the tests are self-administered, so no one is doing anything to you. It's kind of a giant Q-tip, and you get to swab each each part of your nose. I'm sure there's a technical term for that Dr. Blumberg could share with us. 15 seconds on one side, 15 seconds on the other. The health aides are just there to help guide and make sure that you put it up as high enough and kind of help you. There's also mirrors that can help. So a medical professional is really the trained health aides. These tests can be given by a lay person, but they do have to be trained in the protocol. So I even went through the training early on when we were trying to figure this whole process out. I don't do them anymore, but it is a well, kind of overseen process.
Thank you, Victoria. Next slide, please. When will natural immunity from COVID-19 infection be considered? And being vaccinated is unnecessary for those who have been infected, and natural immunity has greater efficacy?
Yeah, so I'll take this one. Before I do, this is my right nares, and this is my left nares. So that's what they're called. But so, it's interesting about natural immunity. What we know is that people who've been infected are very unlikely to get reinfected within 90 days of vaccination. But recently we've had several good studies come out showing how natural immunity compares to vaccine-induced immunity. And there's been some outliers. So there's a whole bunch of different studies that say a bunch of different things, but the vast majority of studies, if you look at them, they show that immunity from vaccination is more consistent than from natural immunity from infection, and that immunity from vaccination is about twice as good as immunity that's acquired from infection. And so I know that several different schools have looked at accepting natural immunity, have considered that, like looking at antibody tests. But again, there's no antibody level that says you're immune. And so the schools that I've heard of that have looked at that have decided not to use that as a correlate of immunity because it's just not as good. It's not as consistent as the immunity acquired from immunization. And as I mentioned, this is I'm making a summary statement. You know, there was one Israeli study that suggested that immunity from infection was better in terms of protection compared to vaccination, but the vast majority of studies show otherwise. And so that's why I don't anticipate that antibody tests are going to replace vaccination certificates.
Thank you so much, Dr. Blumberg. How can we file for a valid exemption?
All right, I will go ahead and take that one. So we really want to drive you back to that website that we mentioned before for submitting our vaccine records. And you really want to, it's that, oh, sorry, I didn't write that one down. I'll have to go back and find that. And you want to follow whatever pathway you're doing. So if it's for staff, you're going to click on that button for staff. If it's for your student, you're going to click on that student button. I think we've had some folks maybe not realize that they clicked on the staff one and got a little confused. Thank you so much, Nikki. That's SCUSD.edu/vaccine exemption there. And so all the instructions can be found on that page, including the exemption form that is in multiple languages as well. So you can print out that form or you can get a copy from your school front office. You're going to fill it out, sign it where indicated, depending on which kind of exemption that you are requesting. Remember, we want you to complete that informed K-12 form and fill out, let us know that you're going to do an exemption, and then upload your signed medical exemption form. And you're going to attach it very similar to how you attach to an email. If you're not able to do that or it's not working for you, we do want to let you know you can bring those to your school's front office. We will accept those paper copies. We'll have you fill out the paper copy of the form, and we have a whole process for how those get scanned and emailed over to our team.
And I'll just add that for the medical exemptions, if you feel like your child has a valid medical reason not to be vaccinated and your doctor won't give you a medical exemption and you believe that they're wrong, you can always ask for a referral to a specialist, whatever's covered by their insurance, and you can ask to be seen by somebody, a specialist in the field. I get those referrals routinely for the medical exemptions and evaluate each children individually for those.
Thank you both. Now, these are questions that I received from parents and guardians in our community. I would like to take my daughter to her own doctor for regular testing. What is the process for that?
Yeah, so I'll share that we do offer free site-based COVID testing at every single school site that your child can access really at any time during the school day or even a little bit before or after school. However, we do understand that if families, want to have testing done by their own provider or maybe, a trusted resource that they have, that we will be developing an additional process for families to, opt in and report these testing requirements through that same kind of portal that you're reporting your vaccine or your exemption. It'll be a very similar portal where you'll upload and attach your weekly testing results, and we will respond and let you know, yes, we've received those and they are documented. So it doesn't exist yet. It's not there now. Sorry, Mr. Flores, but we will be developing that process. And we'll be sharing more details to come either in FAQs or in further communications.
Thank you. Next slide. What if we do not agree for my daughter to be vaccinated or tested weekly? Does that mean the school will not accept my daughter anymore? If so, when will be her last days of in-person learning?
Yeah, so we are really strongly encouraging, our families to, file an exemption if that's something that they really feel strongly about, and to register for testing. This is really for the health and well-being of their own child, as well as, others in our community. So we would really encourage families who are feeling this way, consult with your pediatrician, consult, like Dr. Blumberg, ask for that specialist referral if that's something you can do, or come down and talk with one of our health professionals at a vaccine clinic. We really encourage families to lean into that. However, if a family does choose not to vaccinate, not to file an exemption, and not to register for testing, we are looking at that independent study process starting the beginning of the second semester. We will be reaching out to families throughout December and January to communicate with them, to talk with them, to help provide education. If they have concerns about our testing program, to invite them down, to come get tested themselves. Family members can test, here, to look at, our kits. I've spent time with folks sharing what the kits look like and the resources, because they had some anxieties about that. So I'm really just educating yourselves about the process.
Thank you. Since the ruling from the Fifth Circuit Court that has permanently stopped the mandate requirement from Joe Biden and OSHA, which means SCUSD employees aren't even required to be vaccinated from COVID, why are the students required to still be vaccinated when they have less likelihood of contracting COVID-19 than your employees?
So would you like me to take this one, Nikki, or Superintendent?
Yeah, go ahead. If Raul is not available, please.
Okay. Sure. So I want to say I'm not our legal counsel. However, I do have a kind of a written statement that I can read off. So the reference decision is from a court outside of California that paused the federal government's institution of a vaccine mandate for certain private businesses. So that's pretty key. It does not, however, prohibit Sac City Unified from moving forward with its vaccine resolution requirements for its own staff and students. This court's decision concerns a very different situation and legal authority that's involved with Sac City Unified's authority to require vaccines or exemptions of its own staff and its own students aged 12 and over. So pretty much very different, settings, different authority. So we hope that answered that question.
Thank you. Is governmental funding the driving force for SCUSD pushing an unnecessary requirement on our children? If yes, is money more important than morale, health, and safety? Will SCUSD be assuming any liability for any injuries sustained by the requirement of this vaccine?
Yeah, so we just want to reiterate that, we're actually not, mandating a vaccine, but rather vaccine or a valid exemption is required to attend traditional in-person schooling. I just want to say we deeply value in-person learning, right? We all saw the impacts, and we're seeing them now that our students are back with what happened when our students were away. And we have all experienced that joy that we've seen to bring our students back. Vaccination really is an important tool that we have in our toolbox to avoid outbreaks at schools, which may result in potential temporary school closures. We do not want to see us go back to that. So really, our driving force for using those state and federal funds is to respond to the pandemic, to keep our schools open and to keep our school communities safe. The state does require a number of vaccines for school attendance. And again, we really just advise individuals to consult with their pediatrician. There are medical exemptions available, for those with health concerns about vaccination.
And I would just reiterate, for any concerns about the safety of the vaccines or for side effects, you're going to trust your child's healthcare provider more than you're going to trust me, because you haven't met me. You don't have a relationship with me. And so somebody that you have a relationship your healthcare provider for your child is somebody that I hope you deeply trust. And so I hope you go to them and talk about what they would suggest and take their recommendations.
Okay, this one, I think I'll need Dr. Blumberg. So with all the data available to the public, which shows that among children aged 5 to 17, 1.9 million children have contracted COVID-19. That number is far less than the annual cases of children of the same age range contracting the flu. Out of the 1.9 million cases of COVID-19 in this age group, 1.9% is the mortality rate, most with pre-existing health conditions within the last 12 months, and only 66 kids have died of COVID-19. Why are you attempting to require a vaccine for a population group that isn't even a threat to the environment?
So yeah, I'd just like to say I disagree with some of the numbers in here, and they're a little bit mixed up. So the 1.9 children who've contracted COVID are 5 to 11 years of age. 1.9% mortality, it's not that high. That would be horrible if it was that high. We'd have many more deaths. And more children have died of COVID than we'd routinely expect in a normal influenza year. So during a normal influenza year, we would get about 100, 150 kids in the United States that unfortunately would die from influenza. And with COVID, more than twice that many died in the first year that we had COVID around. So it's deadlier than influenza, and it can be very dangerous for children. And as I mentioned, for the 5 to 11-year-olds, it's the 8th leading cause of death. So I would hope everybody would respect something that's in the top 10 cause of death for children. And I take it very seriously.
Thank you so much.
Thank you very much, Dr. Blumberg. I just want to express my gratitude for being with us for an hour, given your very hectic and busy schedule, and for providing information from an expert level that I know our families and our community is seeking as they deal with their own anxieties around this important decision for them. We just want to continue to recognize that this is, of course, a very personal issue. It's one where I know our families are exploring and asking questions. And as you said, from their primary doctors and other individuals, but having you here and providing direct support and direct information to our families is very valuable as part of our strategy to just continue to encourage our families to think about the vaccine safety. As Member Morawski said, we think that this is an important step to conquer COVID, to make sure that we minimize the material threat that COVID still is to our community. We know that our students are now in space with one another. Our students are learning. They are very committed, as our entire staff is, to doing everything they can to continue to be with each other in person. And that is really the stance that the Board of Education in Sac City wanted to take by making a commitment to stay focused on our health and safety protocols. So we appreciate your partnership. Community members, I hope that you're able to see just the amount of effort that we've put in to ensure the safety of all of our students. And I hope that you will continue to reach out to us with any other questions and concerns that you have. Please bear with us. All of this work is work that our team has had to do really with very little support. The upload process, all of the pages, all of the FAQs, these are not coming from any kind of central repository where we're simply borrowing technology. So if there are hiccups and bugs, please bear with us. Let us know what those are so that we can make this process as seamless and efficient as possible. I'll turn it over very quickly. I know we're a little bit over time. Back to President Pritchett, board members Leticia Garcia and Lisa Morawski for any closing comments.
Thank you, Superintendent, and thank you, staff, for that very informative town hall. I hope this helped our community with understanding the requirements and where to go to upload your documents. Like I said before, our cell phone numbers and email addresses are on the website. And you know how to reach out to us. Please continue to do so. That way we understand the needs of our community. I will leave it to any of my colleagues that are on. Member Garcia. Oh, and Member Morosky, sorry, I just saw your name here. Do you have any closing comments?
I'll just again thank staff for the presentation and Dr. Blumberg. This is a big thing we are doing together to protect the health and safety of our kids and to protect their academic and developmental well-being as well. So just really appreciate the attention, the questions, and we'll just continue on this journey together, and let's just work together to keep our system as safe as possible so our kids can really get back to the the normalcy and just the normal day-to-day things that we all took for granted, because I think that's what we all want to get back to. Thanks.
Thank you, Member Morosky. Member Garcia.
Hi. No, I just wanted to take a moment to just thank everyone who joined us tonight, and all the presenters and staff and everyone. And again, in working together to make sure that our kids stay in the classroom learning so that they suffer no more learning loss, and that they're the healthiest that we can keep them in a classroom setting. So thank you.
Thank you. And thank you again to all the staff once again for putting on this presentation. Superintendent?
No, again, thank you, everyone. I know that it's late and we've gone over our time. Have a wonderful day, and please join us for our board meeting on Thursday. We always want to see community engagement and involvement. We have a board meeting this Thursday. We'll give some updates on the vaccination mandate, probably with more updated data around where we stand with our dashboard. And we just encourage you to bookmark that dashboard so that you can follow along and encourage others in our community to start the upload process, because November 30th is just right around the corner, and we'd love to be as high as possible with proof of that first vaccination for COVID. Thanks again, everyone.